Assalamu alaikum wa rahmatullahi wa barakatuh. My presentation is about association of congenital heart disease in neonates with diabetic mothers. They are my teams, Dr. Ahmad Farid Faqiri, constant neonatologist, Dr. Shabin Ali Nouri, that he has helped me in the making of PowerPoint presentations, my sister Maqbula Sahar, head nurse of NICU and medical record department. My presentation has two parts, short information about CHD, and the second part is my data collection. As you know that the CHD is among the neonates, it's a lesion which occurs antenatally and the beginning of the when the organs are occurring. Then the incidence of CHD is from 5 to 50 in 10,000 of neonates, alive neonates. And we have a lot of complex CHDs and simple CHDs from PD, ASD, VSDs, and the number and with percentages. And just we are talking about the association of CHD among neonates with the diabetic mother. Our objective is, the purpose of our study is to find the incidence of congenital heart disease among the neonates when the mother had gestational diabetes or diabetes mellitus. We have collected the data from retrospectively from the medical department, from the medical record departments, and then we have collected data by SPSS number 24. We have analyzed them. The result was about the same with the region, with the India, with the Pakistan, with the Tajikistan, with this area. It was about the same. It was our result that the percentage of the mother with diabetes and with non-diabetic mother that they have delivered here the babies with CHDs. It was about the same. And age of the mother was 18 to 42. Percentage of existing disease of the mother. Beside of diabetes mellitus, we have mothers that they had pneumonia, like hyperglycemia, hyperthyroidism, UTI, and other with their percentage. The highest percentage was this hyperglycemia, or for example, diabetic mother, it is gestational, or maybe diabetes mellitus. Percentage of cyanosis by child. When the babies were delivered here, it was the percentage of the child with CHD, with the non-CHD neonates, with the mother they had the CHDs, or the mother they had diabetes mellitus or gestational diabetes, the highest percentage of both. Percentage of CPR in neonates, whenever we have received the babies, it is the percentage of the newborns that we have done for them CPR at our FMIC, NICU, or delivery rooms. It was not too much high, but it was yes. Percentage of the CHD types. The highest was the PDA that we had, the number of the PDA that we have found, and the lowest was the complex CHDs like TJ, like coarctation of aorta, and other congenital heart diseases. Gender was, the majority was the male, 64%, and the minority was female, 36%. It was the summary statistics of the mother, that the mother, the number of the pregnancies, birth trimesters, mother's weight, hypertension, number of checkups, how many times they have done checkups, and the last one is hyperglycemia, that among the total number of the mother that they have admitted, it was 33. Association of child with CHD and mother's diabetes was mother with diabetes, we had no CHD 5 neonates, with CHD 34 neonates. The mother that they did not have diabetes, we have 16 neonates with CHDs and 23 CHD that the mother did not have diabetes. Totally 78 neonates were gone under our data collection. Our conclusion is the presence investigations identified that the association between the neonatal congenital heart disease and the mother diabetes status based on some clinical observations. Data from the selected patients who got admitted to NICU of FMIC during the study period. The sampling was completely randomized, and then the results showed that there was an association among CHD and mother diabetes, age, relationship, and the CHD with their children. And this is our discussion that we have done with our teams that among the neonates that we have admitted, and we have found the mothers with their neonates with CHDs. The present investigation is based on the conceptual analysis that outlined that the neonatal congenital heart disease linked with the mother's direction or positive impact on the neonatal CHD with their mothers. Our recommendations goes in three parts. First goes to the family and the patients. Then second goes to the FMIC hospital that we are working for the patients. And the third one goes to other maternity and child hospital. Mothers should control their diabetes by regular checkup. They have to do regular sport. They have to control their diabetes by diet. They are the recommendations for the family, for the patients, or for the mothers. We must improve and increase the number of diabetes centers in our country. We must have regular discussions and education for the mothers because of their diabetes, because of their family educations, and we must have regular family planning discussions about their children's number of the babies, number of the children's, and between the pregnancies, we have to have family educations and family planning discussions. If you have any questions, it was my presentation. Thank you.
Thank you so much, Dr. Safaizi.
بسم الله الرحمن الرحيم وسخر لكم ما في السماوات وما في الأرض جميعا منه إن في ذلك لآيات لقوم يتفكرون صدق الله العلي العظيم. Good day and assalamu alaikum to the all participants, most respected guests, gentlemen, and organizing committee of 14th FMIC Annual International Scientific Conference and 14th Convention. Under the theme, let us by improving quality by accessibility, quality, innovation, and sustainability. Based on this Quranic verse, Allah exhorts Muslims to diverse, observe, and study the universe in order to find some of His sign. For that reason, many verses of Noble Quran invite Muslims to study the nature, and that has been and seek knowledge, and that has been interpreted for encouragement of scientific investigation and research. So today I am going to talk you about my scientific paper, that is prevalence and determinant of malnutrition among children under 5 in Afghanistan, insights from 2022 and 2023 MICS multiple indicator cluster survey. Why do I tell you this? Because my aim and objective with this oral representation is to provide essential data from MICS Afghanistan 2022 and 2023 to guide policies intervention aimed at improving child nutrition. So my topic is prevalence and determinants of malnutrition among children under 5 in Afghanistan, insight from 2022 and 2023 MICS. Let us come to the next slide, introduction. Introduction. First of all, we will have an overview on malnutrition. Malnutrition is a serious global health issue affecting physical and cognitive development in children. Also, we have what is the impact of malnutrition on children. According to our scientific paper and research, Malnutrition has a great effect on children, like increased risk of illness, poor academic performance, and long-term health issue. After that, we will see an overview what is the context of malnutrition in Afghanistan. High rate of malnutrition linked to socio-economic challenges, food insecurities, and also limited health care issues. Second, malnutrition among children under 5 is a critical public issue in Afghanistan. The 2022 and 2023 MICS Afghanistan aims to provide essential data to guide policies intervention focusing on child nutrition and reducing malnutrition. Objective. Our objectives are concluded to provide essential data from 2022 and 2023 multiple indicator cluster survey Afghanistan aimed at improving child nutrition. Our methodology. In this research, our team was used cross-sectional household survey methods. Data source, we used data from multiple indicator cluster survey MICS Afghanistan 2022 and 2023, which is present in the site of UNICEF, and that survey was done by the UNICEF. Sample size, nationally representative sample was 23,568 households. Response rate was 99.8%. Indicator that was assessed in this scientific paper was health, nutrition, socio-economic indicator that was focusing on first, what was the percentage of standing, second, what was the percentage of wasting, third was what was the percentage of underweight, and fourth was what was the percentage of overweight among the children. The result, our team, the result that received by our team was a standing prevalence for 44.7, out of which 21.7% was severe. Wasting prevalence was 3.7%, out of which severe was 1.2%. Underweight was prevalence 18.4%, out of which severe percentage was 5.7%, and overweight was 4.7%. Also, regional variation, high rate of standing and wasting in rural area was greater than to urban areas. Socio-economic impact, children from poor household exhibit higher level of malnutrition. Conclusion, our team was received this conclusion that critical malnutrition, high rate of standing 44.7 and underweight 18.4 was the main percentage of our discussion. Regional disparity, higher malnutrition in rural areas and poor household. Need for action, urgent intervention required to address both acute and chronic malnutrition. Data-driven policy. From this data, we receive finding to provide a foundation for effective national nutrition strategies. Ongoing monitoring. When we draw a national strategy for controlling malnutrition, it is necessary to have an continuous assessment essential for evaluating the intervention effect. We have the following recommendation that enhancement of nutritional access. First of all, we should improve availability of nutrition food. Second, extending of healthcare services. Expand health facilities focusing on child nutrition. Third, promote education. Increase awareness of optimal feeding practices. And fourth was targeting vulnerable area. Focus intervention in rural areas and low-income communities. Monitor regularly. When we draw a strategy for our recommendation, we should regularly assess the effectiveness of nutrition program. Our references was The data was taken from the survey that was done by the UNICEF, and these data are present in spaces in the site of UNICEF. Thank you for your attention.
First of all, I would like to give all colleagues Assalamu alaikum, and I would like to thank from dear colleagues for the holding of this important international conference. The topic of my conference is the effect of dole strain probiotic on the weight gain in premature unit in Kabul city. This is a randomized clinical trial, and I would like to mention here, this is published in a most important and high quality journal of global health in 2023. I am the corresponding author, and my co-author is Associate Professor Dr. Hamidi, and as well as Associate Professor Dr. Atiqullah Halimi, who is present here. Introduction. As you know, Afghanistan has a high neonatal mortality rate. According to the report of UNICEF in 2019, the neonatal mortality rate in Afghanistan is about 37 in every 1,000 live births. It is much higher than other countries. Most of these deed or the most common cause of death in Afghanistan is prematurity. It accounts for 35% of death in Afghanistan. Preterm birth encounter a lot of problems, including slow weight gaining, feeding intolerance, infection, and neonatal mortality and other aspects. During the last few decades, the effect of probiotic are evaluated on the health of neonate. But there is a scientific gap regarding the effect of dual-strain probiotic on the weight gaining of preterm neonate. There are some studies are performed, but the results are conflicting and controversial. On that time, when we start our study on 220. Therefore, we start this study by this objective. Our primary objective is to evaluate the effectiveness of dual-strain probiotic and weight gain, first, age to reach full enteral feed, and hospital stay in preterm neonate with a gestational age of equal to or less than 37, this is a mistake, 37 weeks or weight of less than 2,000 grams in Kabul hospital. Our second objective was to evaluate the risk of feeding intolerance and as well as to evaluate the risk of neonatal death. Methodology, as I mentioned, study design, setting, and time. This is a prospective, randomized, open-label control trial that conducted at the neonatal unit of Malalai Maternity Hospital and neonatal unit of Maiwan Teaching Hospital during 2020 and 2022. Inclusion and exclusion criteria. We included all neonate, all preterm neonate with gestational age of less than 37 weeks and weight of less than 2,000 grams. And we also excluded preterm neonate with weight of less than 1,000 grams, critically ill condition, and the baby's parent declined the consent. This was our inclusion and exclusion criteria. Sampling strategy and sample size. The sampling strategy for this randomized clinical trial was block randomization.
So,
we
Dr. Aslam, you have 1 minute more.
block randomization and the sample size was calculated by Stata 14. And according to the ethical approval, this RCT initially was registered at the Australian New Zealand Clinical Trial Registry, and as well as it was approved by the Department of Neonatology and by the Ministry of Higher Education. Methodology, this is the patient enrollment chart. Initially, we screened the patient. About 107 neonates was screened. After the exclusion of 10 neonates, we allocated the neonate into groups. One group for probiotic, and another group was control group. The results are shown in two tables, table 1 and table 2. Table 1 shows the baseline characteristic of the neonate. As you see in this table, age, weight, and gestational age in both groups are the same, but these findings are not statistically significant because the p-value is more than 0.05. The main result is shown in this table. According to this table, babies in probiotic group, as you seen in table 1, mean daily weight in probiotic group was higher than the control group. 5.5 gram mean daily weight was higher than the control group. This finding was statistically significant. The other finding, as well as the time to reach full enteral feed, it was also decreased in probiotic group than the control. The other finding, hospital stay is decreased than the control group. These three findings are statistically significant. Discussion. According to the result of this study, Dole strain probiotic significantly increased the daily weight gain of premature neonate. This finding is somewhat consistent with the other studies. Two studies are conducted regarding the weight gaining of neonate, one in Germany and other in China. In Germany, they use single strain probiotic. Therefore, the weight gaining was slower than our study. And in China, they use multiple strain of probiotic. Therefore, the finding was slower than our finding. And the other three finding, the time of reach to full enteral feed, heart pistol stay, it is consistent with the other finding. Regarding the feeding intolerance and regarding the neonatal mortality, the finding was not statistically significant. However, feeding intolerance and neonatal mortality rate was lower in probiotic group, but the finding was not statistically significant. Conclusion, Dole strain probiotic significantly increased the mean daily weight gain of the neonate, as well as it decreased the time to reach full enteral feed, and it decreased the time of hospital stay. Therefore, we recommend to use Dole strain probiotic in neonatal units. Fortunately, after the publication of this RCT, this RCT is published in 2023. But now in 2024, we have a meta-analysis that shows probiotic increase the mean daily weight gain in premature neonate, which support our finding. This is our reference, and this is the publication. This is published in Global Pediatric, which belongs to Elsevier. Thanks a lot.
Thank you so much.
Any question?
Participants which are online. So today I'm Dr. Salam Subru. I'm working in Aga University. So I'm presenting today a topic which is evaluation of macronutrient composition and greater water quality in high-fat snacks consumed by children aged 6 to 24 months. So I'm starting with introductions. As we all know that the Pakistan has around 200 million people's populations and growing with a child malnutrition, mortality, and health issues due to poverty. And there's a lot of other issues as well as besides the poverty. One of them is consumptions of high-fat snacks. Currently, we have seen in Pakistan the increasing rate of people to eat snacks due to the convenient choices in areas with limited cooking facilities. And nowadays, the globally trends is focusing upon to convert the healthy snacks over to the unhealthy snacks. For this reason, I have decided to set my objectives in a way. We have analyzed the high-fat snacks for their macronutrients analysis and their water quality parameter analysis, besides the trans fats and the fatty acids profile. So this is the survey design shows that this is a cohort study where we have selected the children at 6 months over to 24 months, where we have around 460 children, out of which 665 children are acute malnourished and 50 are well-nourished. So in this study, we have also surveyed the 24 food recalls for the age groups of after the age of those children at 6 to 24 months. So this survey data was used to extract high-fat snack consumptions to assess macronutrient content in oil or fat quality parameters. So from this, we have included the extracted out the 111 branded, non-branded snack items were included, categorized as follows: 50 types of biscuits, 26 types of crisps, 15 types of cake, and 10 types of meat toast. So the methodology which shows that we have analyzed the protein compositions, oil quality parameters, transparent fatty acids profiling by using the extended reported methods, which are highlighted with the different kinds of reference here. So as I'm discussing the results, initially I'm just letting you know the consumption frequencies of different categorized high-fat snacks in Pakistan among 6 to 24 age groups. We have seen that the biscuits consumption frequency is high, as around 44% children are consuming it at high frequencies, around 32%, and at around 2 times in a day is around 12%. Likewise, Nilco consumed at a low percent, Amix around 6%, whereas cakes and chips is around 30 to 80%. So these are the macronutrient analysis, which shows that the energy content of the potato chip is higher at around 593 calories and lower than sponge cake. Likewise, available carbohydrates are higher in the wheat flour and potato starch chips, and lower in potato chips is around 30.4. Likewise, potato chips contain high fat content, and wheat flour and potato starch contain chips are lower at around 9.1 gram per 100 gram. And dietary fibers is higher in wheat flour chips and lower in fruit cakes. And the moisture content is higher in fruit cakes and lower in milk. Sugar-coated biscuits contain the high content of proteins, and wafers contain the lower. So the age is higher in biscuits and lower in biscuits. So overall, the second one is the quality parameters. The quality parameters that we could analyze are the beta-MCD, peroxide value, total oxidation, conjugated dienes, trienes, and free fatty acids. I have just represented the high and lower values of all my brains, which shows that, and besides the green values shows that the recommended values that are given by the standards FEO and FEA values. So which are shows that in our values the fructose contain the high content of beta-acidines and peroxide value is around 4.1 in wheat flour and fermented starch. Likewise, cupcake contain high content of oxidations and peanut biscuits, fruit cake contain the concentrated ions higher and rusk cake in the free fatty acids. Likewise, the almond, chocolate sandwich biscuits, wafer, round cake, clear cut wafers contain the lower amounts, but overall values shows that they are, except the peroxide values, they contain the high values as compared to what they have recommended to standardized base. So here, this paragraph shows the analysis that we have done for the free fatty acids. The peak at around 966 shows the presence of free fatty acids in all our groups.
Sorry, Madam Somro, you have left 1 minute.
Sure. So here we are I'm just highlighting the and low values of the fatty acids. Saturated fatty acids, unsaturated fatty acids are higher in cocoa chips and round cakes and lower in round cake and choco biscuits. So I'm coming towards the conclusions and the recommendations. Here we are seeing that energy and carbohydrate levels are adequate for delegates, but we also see that the energy levels is compiling highly, from the fat and carbohydrate, which is not good. So all samples showed oil quality parameters above acceptable limits, likely due to extended storage and use of low quality oils. Trans fats detected in 55% of samples, particularly in biscuits and cakes. Likewise, the oils that we have obtained that contain mostly the palm oil. The results indicate that the oils used in these snacks are highly oxidized, rich in saturated fats and contain trans fat, all of which could have adverse effects on digestive health and may impair growth. We are recommending avoid unhealthy snack consumption, especially in infants children. So our future plan is, since this study was limited in scope and sample size, further research is needed with a larger data set to confirm these findings. Future studies should also investigate health impacts on cohort exposed to poor quality oils to establish direct link to potential health issues. Instead, that lead to further analysis process contaminations of the following compounds, acrylamide and so on. So thank you so much for FMIC for giving me a chance to talk. Besides, I just want to finish it with a message that healthy choices build healthy life. Thank you so much. If there's any questions?
Any questions for Madam Somro? No question, Madam. Thank you very much for your nice presentation.
Okay, thank you so much.
So thank you so much. Today I'll be presenting on newborn responsive parenting education in primary healthcare settings of Afghanistan through midwives and lady health workers. This was a model we integrated the new services of offering parenting education regarding newborn early childhood development by using midwives and lady healthcare workers placed in the primary healthcare settings of Pakistan and in Afghanistan. These have been my supporting authors. So as we all know that responsive caregiving in the earliest years of life has a huge impact on young children, their sound mind, body, their verbal, their non-verbal gestures as well. The first 1,000 days of life have a profound impact on health and development outcomes of child and the mother. Now, responsive caregiving is one of the components of nurturing care framework. There are other 4 components like health, nutrition, safety and security, and learning and serenity, and responsive caregiving. So responsive caregiving during the early years of life have proven to be compelling effects on the child cognitive and overall well-being. It also has a huge impact on the future life trajectory and development. And despite so many efforts being made in the rural areas of Afghanistan and in Pakistan, there is a low promotion of responsive parenting in the healthcare settings. So it's very important to engage lady healthcare workers and midwives to serve as cornerstone of health to provide parenting education and early childhood in the communities. Next. So objective of this study is we wanted to apply this broader research initiative that we have done regarding assessing the feasibility of the newborn parenting, and we wanted to see that how the intervention will have an impact in Pakistan and in Afghanistan. So this current presentation aims to explore the feasibility of establishing midwife and lady health worker-led early childhood newborn responsive parenting intervention in the remote areas of Afghanistan. And we wanted to investigate the challenges faced by the lady healthcare workers in the field to explore its full potential to scale it further in Afghanistan and in Pakistan. Next. The methodology we used here was the implementation research, and for this particular component we used the qualitative study as well. The study settings were the healthcare providers and leaders in a primary healthcare settings of Afghanistan. We conducted interviews and focus group discussions, and we did the thematic data analysis as well. We also saw the ethical review approval from AKU as well as the Afghanistan IRB board. Next. There were some preliminary findings that, lady healthcare workers shared with us. These were divided into 4 different categories and thematic categories. That lady healthcare workers before intervention had limited knowledge of the provider pertinent to ECD newborn parenting. There was a lack of integration of ECD nursing curriculum. There were also lack of logistical supports and financial supports that lady healthcare workers were facing. So for the theme one, healthcare providers have mentioned that they have very limited training and knowledge regarding early childhood development, which hinders their effective translation of educational delivery. They also have a very limited access to educational material. So, when they go in the field to teach parents, they do not have a lot of educational materials to share it with the parents. They mentioned that there's also lack of inclusion of nurturing care components in nursing curriculum. So in nursing, they teach and learn about antenatal and postnatal, but there's a limited competency available for early childhood and development. Similarly, in the healthcare workers stream, there are no clinical competencies related to parenting education in their current work scope. So nurses will be, and lady healthcare workers and midwives will be asked that if they have get provided the postnatal education, if they have taught about immunization, if they have taken care of the hygiene, but there are no competencies which allow them or assess them that if they have provided any education regarding early childhood or not. Then there are a lot of logistical transportation issues that lady healthcare workers thought the parents would be facing, because the parents are supposed to come to the field sites, healthcare settings for 6 times. So there are 6 modules that are on which the training is provided to parents. So 6 times they have to come to the center as well. And according to lady healthcare workers and midwives, parents found it really challenging to come 6 times to the center with small babies. And sometimes climate will be an issue, sometimes their socioeconomic status could be an issue. Also healthcare setups, they also mentioned that healthcare setups lack adequate infrastructure and communication to promote responsive parenting to the parents. The healthcare settings do not have posters which has knowledge about ECT. The healthcare facilities usually lack the communication group through which they can send messages to the parents as well. So these were some of the logistic challenges. We also mentioned that financial challenges were also that, the lady healthcare workers and midwives are not provided.
Dr. for interruption, you have 30 seconds, just 30 seconds.
Yes. And also there are no dedicated funds that are provided to early childhood education within the healthcare sector. Next slide. Yes. And this brings us to the final recommendation is there is a need to include a module on early childhood development in nursing curriculum. There's also a need to incentivize the healthcare providers so that they can provide early childhood education as well. There's also a need to enhance the training of the midwives regarding ECD, and we also need to work on improving accessibility for the parents, because healthcare centers can act as a hub to promote early childhood development. Next, and if there are any questions, I'm here and you can ask me later. So the study offered meaningful direction for advancing nursing practice for health education and promoting and leveraging their role in promoting early childhood development in healthcare settings. With this, thank you so much, and thank you FMIC for organizing this conference.
Thank you so much, Dr. Bahani. Thank you so much.
Bismillahirrahmanirrahim. Descriptive epidemiology of cleft and palate in tertiary hospital in Kabul, Afghanistan. Cleft and cleft palate as are congenital deformities resulting from the incomplete fusion of facial tissue in utero, affecting both appearance and function. There is notable variation in the incidence of cleft lip and cleft palate in the worldwide. The certain region and ethnic group are experiencing higher prevalence rate. The annual prevalence of an infant born in USA from 2010 up to 2014 is 1 patient in 10 patient in 10,000 patient. Descriptive epidemiology is crucial of identifying patterns, trends, and disparities of cleft condition. Provide insight the intervention and resource allocation strategy. Our objective is the study aim to describe the epidemiology patterns of cleft lip and palate in tertiary hospital in Kabul, Afghanistan. Methodology, it is our study is descriptive cross-sectional. In Kabul, Afghanistan, our cases 267 cases, and it is the period is from June up to November 2023. And data collection structured and validated questionnaire, and our data analysis IBM SPSS, and our analytic tests frequency and percentage. Our result in our study, and out of the 267 cases, you see the male is predominant than female, and also slightly more than half of participants' mothers' age is in category of 26 to 35 years old. And our 4 or 5 cases are illiterated. All of them is non-educated women. In total, we have in our study, our ethnic group, there is the Pashtunis in the first line, and the Tajiks in the second line, and the Hazara and other teams, other groups are in the other lines. Among of cleft, when in our study we saw the location of the clefts, or unilateral cleft were most common in our patients, and following by bilateral cleft lip, your two-side cleft lip is the second line, and the right side cleft lip is in the third line. Also, in cleft lip is more frequent than incomplete cleft lip. Also, in cleft palate, complete cleft palate, they predominant than soft cleft palate, and the submucosal cleft and uvula bifida is rare. Alveolar involvement is observed in our study. It is big consanguineous marriage is identified in the upstairs, because all of our culture is the same, and the genetic predisposition is also in cleft lip and cleft palate is present. Gender deformity difference was observed. Complete cleft lip and palate were more frequent in male than female. Discussion in our study, we found slight male predominance than female, and also half of more than half of our mothers are non-educated. All of them is a few cases are illiterated. All of them is non-educated, and also they suggest socioeconomic and education factors may play a role in the occurrence of these congenital anomalies. Among cleft lip cases, left unilateral is most common, then right side, and also cleft palate is predominant, then soft and uvula bifida or submucosal cleft. The high rate consanguineous marriages you see in the high percentages, and it is indicated as strong genetic components to cleft lip and palate. Conclusion and recommendation: our study highlights a significant epidemiologically characteristic of cleft lip and palate in couple, including prevalence patterns, potential genetic risk factors, and demographic association. In investing the woman's education and ensuring widespread access to prenatal care and screening, could help identify to counseling with for avoidance of cleft lip and palate. Also, establish specialized genetic counseling services and raising community awareness about hereditary nature of these conditions could empower families to make informed reproductive choice and seek their intervention. Acknowledgement: Cure Hospital, B International Team, Areta Remark Research Organization, participant of study. Thank you.
My presentation, Assalamu alaikum to everyone. And my presentation is using COMS criteria for pediatric population and pediatric ICU of AQH. Next, please. And this is a disclosure. There is no funding, and all the authors, co-authors have no conflict of interest, and they declared no conflict of interest. Next. This is the layout of my presentation. We will discuss the introduction, objectives, methodology, result, holding the gate, and conclusion. Next, please. Introduction. As we all know that mechanical ventilation is one of the very crucial thing for the advancing the life and support the life. And but for the if mechanical ventilation prolongs, then it will be a kind of with the multiple complications like pneumonia and other things. So next, please. So early extubation is very important, and for this we have reviewed multiple literatures, and by reviewing the multiple literatures we find out that there is multiple things which are very important to decide the early extubation and to see the child or patient is ready for the extubation or not. After multiple review of the literature, we find out one mnemonic which is COMS, which is helpful for us to make a checklist to check the readiness of the extubation of the child. Either child is ready for the extubation or not. Next, please. The objective and purpose of this study was that we want to extubate our children very safely and effectively, and to find out a standardized checklist so which we can be used before the extubation and all the complication can be prevented. Next, please. These are the literatures which we have reviewed. Next, please. Next, please. Okay. So I'm talking about the COMS. What is COMS? COMS is a mnemonic by which we are observing the patient for the neurological assessment, airway assessment, and lungs compliance, muscle strength, and the ability of the secretions to take out by the patient or the maintaining the airway because of the secretions. Next, please. Take the component in which in neurological assessment we see the patient is alert, awake, and for airway, the airway is patent. There is no upper airway obstructions is there. A lung, what are the oxygenation is this before the extubation, and muscle strength, the ability to cough, gag, and suction, secretions, take out the secretions. And in secretions, we will see how much the secretions is there. If we take out the intubation, when they extubate the patient, the airway will not be blocked by the secretions only. Next, please. This is a checklist which we have prepared after one of the 3 months of pilot project. In the beginning, we are just check what was the indication of the intubation, is this resolved or not? Or before that, we will also assess this, is this a high-risk airway or not? Because if there is a high-risk airway, then we will need anesthesia or something special to deal with the ENT. And then we will follow these 5 criteria. And before extubation, we will also see 2 major components, which is one of the sedation or any muscle relaxant or any medication which can lead to re-intubation. And secondly, we will see all the electrolytes, because we all know that if sodium potassium is up and down, so this extubation can lead to be a failure. Next, please. So this study was done in a PICU of Aga Khan Hospital, and we were focused on only those patients who are planned for the extubation. And inclusion criteria was all the patients who are mechanical ventilated and going through the planned extubation. And we exclude all the patients whose ventilation was withdrawn, or because of any reason it will not be planned, extubation was not planned. And before that, during this procedure, we were going through as soon as we know that now this is the primary issue is resolved, we start spontaneous breathing trials to that patient. So it is mandatory before the extubation, all the childs should have their spontaneous breathing trial. Next, please. And for this, we follow the PICO framework with the patient of the PICU who are planned for the extubation, and we go for the CAMS criteria for them. And interventions, all the checklist was followed, and we compared the data with the previous last year. The 9 months were before that there was no criteria was followed. These patients were reviewed, and for 3 months there was a study period and implementation phase. So all this data was collected, and after that 4.5 years we collect the data for the patients who are going through this criteria. Next, please. So for this, we have developed a checklist. All the nurses and doctors are allowed, were trained for this checklist and for this criteria. The extubation in AQH is done by the doctors only, but for nurses, we have to train them. Either all these things can be reviewed by themselves also, because secretions, muscle strength, electrolytes, all are monitored by the nurses, and these are the warning, or they can ask doctor, this is the reason, or this is the patient condition. So we can re-evaluate this thing. Okay? And after that, all the components were managed. Next, please. The timeline was, the first, as I said, 6 months was the previous data when checklist was not implemented, and in 3 months the training was there, and we also monitoring the efficacy of this checklist. Okay? And in third phase, the checklist was on the floor, and we monitored the 4.5 years of data, and we also do the reinforcement and retraining of the patients or staff. Reason is this, you all know that there is a turnover rate, and doctors are changing every 2 or 3 months. So there have to be process followed, what is the process, and hands-on and effectiveness of be there. Next, please. In result, total in 4.5 years, there were 2,927 patients was admitted, and ventilated patient was 1,100, and remaining patients' airway was maintained by the non-invasive ventilation and oxygenations. Next, please. Out of 1,100 patients, 802, which is 72.7% patients were going through this CAMS criteria, and 27.3 were not, because they are those ventilated patients who was ultimately withdrawal or due to some reason they cannot survive. Next, please. And out of this 802, only 32
Sorry,
patients.
ma'am, the time is up. Just a little conclusion.
Okay. Only 4% was reintubated. Next, please. And this is the graph of our intubation. Next, please. Discussion. There was we saw that the impact of this checklist was very good, and quarterly the reinforcement is done, and appreciate the staff for their efforts. Next, please. This was the again we will ongoing basis where we are doing the audit and reinforcing our staff and share the data for the improvement wherever we need it. Next, please. Limitation was this: the study was done only in PICU, and this was a single study. And validation, there is a problem that it may be some doctors who have a different opinion for the neurological assessment and muscle strength, and the staff was changing all the time. Next, please. And the strength was this: the team, there was regular assessment was doing either project is going on or not, going well or not. Ongoing training was done, and staff was appreciated as doctors and nurses for their efforts and their compliance. Next, please. In summary, we find that the CAMS criteria is very effective. It gave us a very standardized checklist, and I will recommend it that this study can be done further in the other areas, and it is a very safety patient program. Thank you, and any questions?
Thank you so much, ma'am. Thank you.
اللهم لا سهل إلا ما جعلته سهلا وأنت تجعل الحزنة إذا شئت سهلا. I want to present a case report of hemorrhagic ulcerative gastric lymphangioma in the infant. First, I will start a brief introduction of the lymphangioma. Lymphangioma is a congenital malformation mostly presenting in the head and neck in the early childhood. Its occurrence in the stomach is exceedingly rare, with no reported case in infant to date. Due to its often asymptomatic nature,
sorry, Dr. Subshanwari, we are out of time, so you have just 5 minutes to finish the presentation.
Due to its often asymptomatic nature and the limitation of the radiological investigation in providing a definite diagnosis, gastric lymphangioma poses a significant diagnostic challenge, especially in the pediatric patients. We present a case of successful surgical management of gastric lymphangioma, which preoperatively mimicked duodenal obstruction. Our aim is to emphasize the rarity of this condition and the complexity of its surgical treatment and its clinical manifestation in pediatric patients. Case presentation. A 6-month-old infant was brought to the emergency room with complaint of 3-day history of poor sucking, fever, and feeding intolerance, frequent non-bilious vomiting, and hematemesis for 2 months. On physical exam, the infant appeared pale and drowsy. Abdomen was soft, though slightly distant in the upper region, with a small palpable mass in the epigastric region. We did abdominal X-ray, abdominal plane X-ray showing a significant distended stomach, raising the possibility of gastric outlet obstruction. Then we did upper gastrointestinal contrast study, show distant stomach and duodenum down to its distal part with no further passage of contrast material, which represent a duodenal obstruction. All the lab findings were unremarkable aside from low hemoglobin level, which was corrected pre-operatively. Treatment. Aliprotomy was planned and done. The finding are there was a bond between duodenum and jejunum, which caused mild stenosis in the distal portion of the duodenum. The bond and this stenotic area were released. A cystic mass was palpated within the body of the stomach. Upon opening the stomach, the cystic mass was found to involve the body in 2/3 of the intestine, with evidence of surface ulceration and surrounding inflammation. The mass, along with suspicious tissue from the fundus along to the major curvature to the antrum, was completely excised in a manner similar to vertical sleeve gastrectomy and sent for histopathologic examination. The stomach was then repaired from the fundus to the antrum using a sieve-like procedure. The post-operative period was uneventful and tolerated feeding. At the 18-month follow-up, the outcome remained favorable, with the patient tolerating feeding well and administering healthy weight gain. Intraoperative image of cystic lymphangioma inside the stomach with evidence ulcer and surrounding inflammation. Discussion. Lymphangioma are predominantly affect newborn and children, typically manifesting in head and neck. However, its occurrence in the intra-abdominal location, particularly in the stomach, is exceedingly rare. Lymphangioma account for approximately 6% of all benign tumors and exhibit an equal distribution across genders and ethnicities. Patients with intra-abdominal lymphangioma are often asymptomatic, with diagnosis typically made incidentally. Complete surgical excision is the treatment of choice for gastric lymphangioma, offering favorable prognosis. Ultrasound is a valuable tool for post-operative follow-up. Based on our knowledge, diagnosing and managing gastric lymphangioma, significant challenge for surgeons. Conclusion. Gastric lymphangioma poses both diagnostic and surgical challenge in infants. Although rare in this population, it should be considered in patients presenting frequent vomiting and hematemesis. Thank you.
What is the difference of your case with the current literature? What is the difference of your case with the current literature, with the published cases and the current literature? What is the difference?
I mentioned previously that our aim is to emphasize the rarity of this condition. So it was incidentally diagnosis. Only surgical excision is required for this patient. Not if the lymphangioma, other side we can do sclerotherapy. But it was in the stomach that we can do, and there was no any literatures about the endoscopic sclerotherapy. Now we suggest only surgical excisions.
Muhammad Yasin Hakimi, to Dr. Saib Mansoor Aslamzai, Dr. Fana,
lastly, may invite Mr. Ghulam Rahim Awad to present the mementos to our distinguished chair and co-chair.
Thank you, Dr. Sayyidullah Safi.
I would like to call upon stage Mr. Ghulam Jilani Atai from Ministry of Public Health. Dr. Ghulam Jilani Atai is a stomatologist from Kunduz, Afghanistan, with more than 20 years of experience in immunization, nursing, pharmacy, radiology, leadership, and management monitoring. Please, the floor is yours. Thank you.
Thank you. نحمده و نصلی علی رسوله الکریم ما بعد فاعوذ بالله من الشیطان الرجیم بسم الله الرحمن الرحیم. په سر کې زه د پنل اعضاونه غوښتنه کوم چې دغه پریزنټیشن زه په لوکل ژبه باندې پریزنټ کوم چون وخت کم دی که ستاسو اجازه وي. زمونږ د ټاپیک موضوع ریزن اف پولیو واکسین ریفیوزل امنگ فامیلیز ان قندوز فاریاب جوزجان in افغانستان سال 2024. معرفی فلج اطفال یک بیماری ساری فلج کننده است که از طریق ویروس به وجود میاد و اطفال در هر سن و سال فلج میکنه. به طور خلاصه در سال 1988 بیشترین واقعات این مرض که 350,000 واقعات بود ای به ثبت رسیده بود. بعد از اینکه واکسین معرفی شده پروگرام ای به شکل دراماتیک در 125 کشور جهان ای واقعات وجود داشت و فعلا در افغانستان و پاکستان ای واقعات موجود است. ابجکتیو ما تعیین دلایل رد واکسین در خانواده های رد در 3 ولایت بود که ما در اینجا انجام دادیم. خب هدف خاص ما تعیین دلایل اطفال رد بود در ولایت های جوزجان، فاریاب و کندوز است که دلایل از این یا سپیسیفیک ابجکتیو ما تعیین پوشش واکسین در خانواده های رد بود و همچنان ارائه توصیه ها برای وزارت صحت عامه برای پروگرام های آینده. استادی دیزاین ما یک مطالعه دیسکریپتیو بود که ای انجام شد در 3 ولایت. استادی پاپولیشن ما فامیلایی بودند که در حوزه ملی واکسیناسیون اطفال خود اجازه نمیدادند که واکسین شود و همچنان استادی ستینگ ما نفوسی بود که در ساحات اربن و ساحات رورال موجود بود و ما به خاطر ازی 20 ولسوالی را انتخاب کردیم. سامپل سایز ما در مجموع 325 سامپل سایز در 3 ولایت بود. دیتا کلکشن ما توسط سوالنامه از قبل ترتیب شده جمع آوری شده. دیتا در اکسل و ایپینفو انتری و پاکسازی شده و همچنان از آمار توصیفی فریکونسی پرسنتیج و مینز ما استفاده کردیم. ریزالت میریم. در ریزالت نتایج در این گراف میخوایم چون وقت کم است پرزنت بکنم. دلایل عمده که در این استادی ما دریافت کردیم بیشترین فامیلا که 40% فامیلا اجازه واکسین نداده بودند و همچنان دوری از مراکز صحی کمترین دلایلی بود که در این ریسرچ ما دریافت کردیم. و این همچنان کوریج واکسین اطفال در روتین بود که به اساس کارت ایرا ما دریافت کردیم و همچنان ریکال بود نتایجی که ما به دست آوردیم. یک موضوع را میخوایم اشاره بکنم که دستاورد بزرگ این ریسرچ ما می بود که در بین اطفال ریفیوزل ما 7% اطفال دوباره واکسین کردیم توسط اونمو سرویرها و یا توسط تیمی که ما این ریسرچ انجام دادیم. یک دستاورد بزرگ است که این انجام شده. به طور خلاصه میگیم در دیسکشن میریم. بزرگترین دلیلی که پیدا شد در این ریسرچ ما خانواده ها اجازه نمیدادند که اطفال خود واکسین بکنه و موضوع دیگه که دوری مراکز صحی بود از خانه هایشان و همچنان بعضی فامیلا اجازه را نمیدادند که اطفال خود واکسین بکنن که میگفتند که واکسین اقیمی است و توسط شایعات محلی اونا معتقد شده بودند که اطفال خود واکسین نکنن. و همچنان یک ریسرچ در پاکستان هم نشان داده بود که تطبیق کمپاین‌های تکراری هم باعث از شده بود که مردم واکسین رد بکنه و همچنان در این مطالعه ما دریافتیم که دوری مراکز صحی باعث شده بود که یک تعداد مردم واکسین رد بکنن. خب در برخی از مناطق افغانستان هم در سال 2020 در ماه می تا 2024 هم کمپاین‌های تکراری در اونجا نشان داد که مردم از کوبیدن در به دروازه ها توسط رضاکارا خسته شده بودند و واکسین رد می‌کردند. کانکلوژن و پیشنهادات مایی است که بیشترین دلایلی که در این ریسرچ گزارش شده بود امی بود که دوری مراکز صحی و همچنان خانواده ها اجازه نمیدادند که اطفال خود واکسین بکنن و همچنان در این ریسرچ بعضی فامیل ها معتقد نبودن که این واکسین بپذیرن و اونا فکر میکردن که واکسین باعث یقمی و بی‌باوری در بین اطفالشان میشه. به خاطر از اینکه ما پولیو را از افغانستان ریشه‌کن بکنیم، جامعه را باید ما متقاعد بسازیم و جامعه را ما دری شریک بسازیم تا بتانیم به اهداف خود برسیم و همچنان پروگرام‌های اوتریچ خود، موبایل خود به اصطلاح اینتگریت بکنیم تا بتانیم به اهداف خود برسیم. بسیار زیاد تشکر از اینکه وقت کم بود از پنل و از تمام اعضایی که در اینجا حضور دارن و خصوصا استادایی که ما در این مدت زحمت کشیدن. جهان سپاس. ډیر زیاته مننه.
So my study topic is like clinical and demographic profile of children with measles and hospitalized in FMIC, Kabul, Afghanistan. And author is me, myself, Nijatullah Safi, Dr. Wali Aryan and Ahmad Masih Hadari. So before coming to my study, I will just have a quick review of measles. So measles is a acutely highly contagious disease, which is seriously airborne disease caused by the virus that can lead to severe complication and death. Even though a safe and cost-effective vaccine is available in 2002, there were estimated 136,000 measles deaths globally, mostly among unvaccinated and under-vaccinated children under the 5 years. So in Afghanistan, from January 2021 and to 13 March 2002, there have been 48,366 cases and associated with 250 cases from measles. In 2022 alone, there have been over 18,000 cases and 142 children died from measles in the country. So this is our Afghanistan maps, and you are seeing that area with the yellow to red and with the brown in the middle. So you are seeing that mostly our eastern and western provinces are more affected with the measles, and with including some northern areas as well. So it is like you are seeing the most red color with more than 300 cases per million populations. So the objective was the study was to document the clinical and demographic profile of children hospitalized with measles at FMIC, and to provide insight for intervention and healthcare care planning. So methodology was study design was retrospective study review was, and the period was January 2024 to August 2024. The location is FMIC, and the sample size was 100 cases of measles patient that hospitalized with the measles diagnosis. So data collected was the demographic, clinical feature, complication, and outcomes. And the descriptive statistics was analyzed for this study. So the result is in our result, the 78% was male children, and the mean age was 25 months. So the age distribution, we just take from 0 months to 6 months, it was categorically, and then 7 to 12 months another category, and then 13 to 48 months another category. So the high incidence in infant especially was at 8 months. So you are seeing that mostly our cases was the age was the 7 to 12 months, and then the second row was the 13 to 48 months. The gender distribution of the patient was 78 male and 22 was female. And you are seeing that the vaccination coverage among the hospital measles patient. So there was a 66% of the patient was receiving 2 doses of measles vaccinated. and the 34% was the partially vaccinated or just received the one dose of the vaccine. So the result, the most common complication for the clinical profile was the pneumonia, and then the second was diarrhea and sore throat and croup and febrile seizures. So the pneumonia was the leading cause of the complication, and because of the pneumonia, the mostly patient was admitted. So you are seeing that graph as well. So vaccination coverage was among our patients, that 100 cases was 66% who received 2 doses of vaccination. And the nutrition status was that the 52% was undernourished. The malnutrition linked to a high vulnerability to severe complication. Average length stay was the 5 days. Complication and program stays indicate the healthcare system burden. Conclusion. The majority of cases was the 7 to 12 months of age group, predominantly male. Pneumonia was the most frequent complication. Vaccine coverage was suboptimal, and high malnutrition prevalence suggests a need for nutritional intervention. Increased vaccination coverage also our recommendation. So this conclusion, integrated nutrition program and further research to assess the combined impact of nutrition and immunization intervention for outcome. Thank you.
Assalamu alaikum. Good afternoon, everyone. I'm honored to present our study titled Uptake of COVID-19 Vaccination and Related Factors Among the Adult Population in Parwan Province on 2022. Meanwhile, I would like to express my gratitude to my colleagues and ECA and UCSF University of San Francisco, California, who supported me to make this study possible. Next, please. Vaccination stands as one of the most crucial public health intervention for preventing the transmission and mortality associated with the various infection diseases. Several type of COVID-19 vaccine were developed by the various countries around the global, and which shows the different effectiveness of the vaccination. We presented here the most three common type of vaccine available or common in Afghanistan, particularly in the Parwan province. The first one is AstraZeneca, shows 72% effectiveness. Sinopharm shows 79% effectiveness, and Johnson Johnson shows 84% effectiveness. Meanwhile, the coverage of COVID-19 vaccination in this region compared to Afghanistan, that China has 92.8% coverage, Pakistan has 73.4% of overall its population. It's compared to Afghanistan. Afghanistan COVID-19 vaccination coverage is 36.1%. Which is less than all countries in this region. Study objective and study design determine the prevalence of the COVID-19 vaccine uptake and factors influencing the coverage among the adult population in Parwan province. The next objective is understand the coverage of COVID-19 vaccine and its factors influencing the uptake is essential. Study design, it's a cross-sectional study, household survey, door-to-door visit. We used a structured interview questionnaire in this study, and study location was Parwan province, but it's covered both urban and rural areas. It's methodology, study design, and it was a study, as I said before, population-based cross-sectional household survey in Parwan province. We used two-stage cluster sampling, and the total sample size was 1,360 adults. Final analysis, including 1,012 participants for the after the excluding incomplete data. Data collection conducted via structured questionnaire administration through Kobo Toolbox on Android tablets. After the collection of data, we analyzed this data in the S-Data 17 software. And ethical approval, we got the IRB approval and also verbal informed consent. Result, vaccine uptake rate in this province was 31% of overall population among surveyed adults in this province. Age, no significant difference by the age group, and also uptake slightly higher in the male compared to the females. Socioeconomic factors, education, significantly higher uptake among those who attended the school, and also income was highly significant in uptake of COVID-19 vaccine. Access to technology and media exposure was also significant. Discussion, low vaccine uptake, only 31% of the population in this province received their vaccinated against the COVID-19. At least they got one dose of vaccine. Key predictor of the uptake, education, income, and also the role of technology and media, and the implication of the public health. This is the conclusion and recommendation: enhance education initiative, improve economic accessibility, leverage technology for outreach, and expand media and campaign, address misinformation, and further research. Thank you.
Thank you so much. We would like to call upon Mr. Nur Hassan Saidi to present his presentation regarding bacterial slates and their antimicrobial susceptibility patterns amongst pediatric patients with urinary tract infection. Thank you. Mr. Nur Hassan Saidi holds a Bachelor in Science in Medical Lab Technology, and currently he is pursuing Masters in Microbiology from Afghanistan International University. Thank you very much.
Thank you, sir. In the name of Allah, Rabbi Shrah li Sadri wa Yassir li Amri wa Ahlul Uqdata min Lisani yahfazu qawli. My topic is about bacterial isolates and their antimicrobial susceptibility patterns among pediatric UTI with urinary tract infection. This is our team members. This outlines I will introduce step by step. Introduction. Urinary tract infection is defined as a significant bacterial growth with a single pathogen, at least 10,000 colony-forming units per milliliter in clean catch midstream urine, and also presence of leukocyte more than 5 per high power field in spot urine sample and UTI symptoms. The most common symptoms of UTI in infants is fever, and UTI should be considered in any patient younger than 2 years of age, presenting with unexplained fever. Other symptoms such as abdominal pain, frequency, dysuria, urgency, hystensia, neurosis, and hematuria can also be seen in UTI patients. Use of irregular and self-medication antibiotics is serious and alarming condition in our country, increasing of the emergency of MDRO, challenging clinicians in treating UTI patients. It's very important to control the spread of multi-drug resistance. Demonstrate the types of organisms isolated antimicrobial sensitivity spectrum multi-drug resistance amongst the cases diagnosed at FMIC Kabul, Afghanistan. Our purpose in this study to determine the prevalence of UTI among pediatric patients under 5 years of age in FMIC with its UTI symptoms, and also to find the resistance of antibiotic in most common isolated organisms. Methodology. This study is a descriptive cross-sectional which is done in the Department of Laboratory FMIC. Sampling methods, consecutive non-probability sampling is used for this study. All the cases that were equal or less than 5 years of age, and demonstrate positive urine cultures for a single pathogenic organism. This study duration is 1 year from January up to December of 2023. Data was collected through FMIC laboratory software integrated laboratory management system, and approval was obtained from ethic review committee of FMIC. And the isolation of organisms used clade agar and UTI chromogenic agar. And for identification of organisms, we used API tenase, 20 oxidase catalase, and coagulase tests. And the antibiotic susceptibility, we used this diffusion with 0.5 McFarland on MHA. Data was analyzed with Data was analyzed with SPSS 25 version. All those children with UTI symptoms under 5 years of age with a single pathogenic isolated or in clean Kashmir stream are included in our study, and those children with more than 5 years of age and more than one isolated of organisms in clean Kashmir midstream urine is not included to our study. This is our results to show the female is more than caused in UTI, and this graph shows the organisms which isolated, which E. coli is the most pathogenic UTI, and following by Klebsiella, Candida, and others. And this is shows the extended spectrum beta-lactamase distribution. Discussion. A review in the United Kingdom demonstrate utility of urine dipstick test, in which dipstick positive for both leukocyte and nitrate positive 95% or microscopy positive for both pyuria and bacteriuria was significant associated with UTI. And another study in Turkey which demonstrate the majority of UTI was female than male, and E. coli was the frequent microorganism, the most frequent. And in another study also conducted in Tehran, which is show similarly the majority of E. coli is more than followed by Klebsiella, Proteus, and Staphylococcus species, and also the lowest resistant to ciprofloxacin and the highest resistant to penicillin. In another study also shows the in Iraq, which is female is more than effect, and the common bacterial isolated was E. coli, followed by Klebsiella pneumoniae and Staphylococcus species. Conclusion, considering the high prevalence of UTI pediatric patients and non-specific signs and symptoms, particularly in infants and young children, the delay in the diagnosis and treatment can lead to complication. Urine sample should be therefore be analyzed for all pediatric patients presenting with fever, and if there is pyuria culture should be performed. And recommendation, the large-scale multi-intestinal studies are needed in the pediatric population to better define the best therapeutic management strategies in cases with antimicrobial resistance and evaluate the benefit of long-term antibiotics prophylaxis. This is our reference. Thank you for your attention.
So what is TB? TB is a high infectious disease caused by a bacteria, and it spreads when a person coughs, speaks or sneezes through the air. So TB is the leading cause of death from an infectious agent. It is the 13th leading cause of death from anything. And also, the next slide, please. Or should I? I can change it, yeah, good. So, TB is the leading cause of death worldwide from an infectious agent, the 13th leading cause of death, and the second deadliest infectious disease after COVID-19, surpassing HIV. So every year, around 10 million people diagnosed with TB, and every year, around 1.5 million people die from the TB. Most cases of the TB occur in the low and middle income countries because of the lack of awareness and also the lack of preventable methods in these countries. So coming down to the Afghanistan ranks 24th among the countries with a high TB burden. In 2020, TB killed 10,000 people in Afghanistan, which was higher than COVID-19 deaths in that year. So here we can see the differences between the paying attention to the COVID-19 and to the TB. So. And the next topic and the next important thing in the TB is drug-resistant TB. Timely screening and managing of TB is essential for it, because if a person mismanage, don't use his medicines regularly, so it causes the drug-resistant TB, which is a global challenge that is growing, resulting from incorrect use and mismanagement of TB drugs. So, according to the importance of the topic, every year the March 24th is celebrated as World TB Day. So, no study has evaluated knowledge, attitude, and practices of students in Afghanistan regarding TB. This is the first study that evaluated the knowledge, attitude, and practices regarding TB. One minute. Okay. The study objective and study design. The main objective of the study was to evaluate to assess the level of knowledge, attitude, and practices of university students regarding tuberculosis. And the second objective was to know the differences between the CAP and medical and non-medical students. The study design, this was a cross-sectional questionnaire-based study. Study location, this study was conducted in Kabul and Kabul University of Medical Sciences. The study period, this study was conducted in the last quarter of 2022, October, November, and December. Methodology, so we calculated the number of the sample through Cochrane formulas. First, we calculated the total number of the population, which was 20,171, and then through Cochrane formulas, we calculated the sample size, which was 415. And regarding the sampling method, a multi-stage stratified sampling was conducted to recruit the people, participant into the study. So first, we divided the universities into two like strata, Kabul University and Kabul University of Medical Sciences, and then within each university, the faculty was also selected, and within each faculty, first we randomly selected the classes, and then we selected the students. So data were analyzed using SPSS version 25, and we used descriptive statistics and also chi-square test and cross-tabulation. The results. As I said before, a total of 415 questionnaires were distributed, but we then received 400 questionnaires. The rest were because of had a high number of missing data, so we didn't use that in the analysis. Of all the participants, 105 were health faculty students, and the rest were non-health faculty students. So students' knowledge about TB, so among all the participants, the results of this study showed that 18.1% of health faculty students and 2.4% of non-health faculty students had good knowledge about TB. We can see the lack of knowledge here, since they were health faculty students, but still the level of good knowledge was 18.1% in them, and the rest had poor knowledge. Students' attitude about TB, the results of this study showed that 26% of health faculty students and 14.9% of non-health faculty students had good attitude about TB. Again, we see the lack of proper attitude in both health and non-health faculty students. So in the rest of the results you can see in the tables. Because of the lack of the time, I will not go down to them. Students' practices about TB, the results of this study showed that 41% of health faculty students and 29.6% of non-health faculty students had good practices regarding TB, and the rest had poor practices regarding TB. So, differences in knowledge, attitude, and practices. According to the result of this study, the health faculty students had better knowledge had better knowledge, attitude, and practices regarding tuberculosis than non-health faculty students, according to the faculty they were studying. But still, the level of CUP and health faculty students were also not sufficient. And also in this study, there were no significant differences in students' knowledge, attitude, and practices according to the socio-demographic characteristics, sex, and year of education. So, discussion and conclusion. In conclusion, we can say like the level of knowledge, attitude, and practices was insufficient in both health faculty students and non-health faculty students. But the health faculty student had better knowledge than the non-health faculty student, but still that was not adequate. Discussion and regarding the attitude, yeah, I covered all of them. Recommendations. So according to the finding of this study, there is a need for increased public awareness campaigns to educate individual about TB. And as we mentioned before, the level of knowledge was not sufficient in the medical students as well. So we can, in the non-medical as well, so we can integrate the TB into their education curriculum, so they can learn it from the base. And also, if you want to solve the problem from the base, so we can integrate the education of TB and the school curriculum as well. So I think I missed one thing. We also analyze the source of information. We had one question regarding the source of information, that the information they had about TB was from what source and where they collected it. So and that the most response was family and friends, and the next were TV and internet and social media had the third stage. So regarding this, we can say that we can also integrate the TB awareness campaigns through the TV and through the social media as well, because they had a big part in awareing people about the TB. That was all. Any questions are welcome. I will be able for answering it later. Thank you so much.
So my study is about the comparative assessments of stool antigen and serum antibody test of H. pylori infection among symptomatic patients at a tertiary hospital in Kabul. These are my research team. H. pylori infection is a significant cause of GI disorder. The global prevalence of this infection has exceeded 50% of the population. Although there is no study in Afghanistan, only H. pylori prevalence is uncertain in Afghanistan. A study which was conducted in Andhoi district of Faryab province highlights 73% of prevalence. Diagnosis involved invasive and non-invasive tests. Invasives are rapid urethritis, endoscopy, and tissue specimen. Non-invasives are urea breed test, stool H. pylori antigen, and antibody. This is my objective, to compare antigen and antibody detection test used for diagnosing the H. pylori infection in symptomatic patients. These are the methodology cross-sectional study which were done in Kabul, Afghanistan. Dyspeptic patients not taking PPI in last 2 weeks. It was a 6-month duration. Structured and validated questionnaire were used for data collection, and IBM SPSS version 26 were used for data analysis. And the analytic tests that we used were frequency, percentage, ROC, AUC, positive predictive and negative predictive values. These are the results out of these 68 symptomatic patients. Nearly 70% of these patients were female. Literacy level was 50%. Nearly 70% of the participants lived in the urban area, and 90% of these patients did not have any habit. These are the symptoms-wise: abdominal pain and discomfort, early satiety, postprandial fullness, nausea and bloating were around 76 to 68%. The other results are the nearly 60 out of these 68 patients, which were 50% were positive by the serum antibody, 38 were positive by the stool antigen, and 38 were positive by the urea breed test. These are the further results of the stool antigen, their sensitivity, specificity, positive predictive, negative predictive value, which were 96%, 97.5, 96 and 97.5% respectively. On the other hand, serum antibody, you see that the sensitivity were around 73, specificity were around 67.5, positive and negative predictive value were 61 and 78% respectively. These are the further tests which you see, the stool antigen ROC, which is receiver operating characteristics curve. You see it's narrow, and for the antibody test it's a bit wide, which shows the accuracy. Finding of these studies suggests that the stool antigen tests provide higher sensitivity and specificity along with the reliable predictive values. Furthermore, results of the ROC curve project higher accuracy level of the stool antigen test for H. pylori infection. On the other hand, if you see the serum antibody test provide lower sensitivity, lower specificity, and lower predictive values. And serum antibody tests also provide lower accuracy level as well. In conclusion, the stool antigen test is a highly sensitive and specific diagnostic tool for detecting H. pylori infection among symptomatic patients. Finding of this study suggests that stool antigen test for H. pylori infection is a reliable and accurate alternatives to urea breed test because of its cost, gold standard of this infection's diagnosis. Relying on this finding of this study, it is recommended that clinician can rely on the result of stool antigen because it's as accurate as urea breed test. And on the other hand, based on the finding of this study, it is recommended to cautiously prescribe antibody test for diagnosis. These are my acknowledgements. Thanks from your attention.
Thank you so much.
Thank you. Thank you so much. Thank you.
Thank to the panel members, all the guests who are present in the hall. My study was about the immunization coverage among under 2 years children of returnee families coming back from Pakistan to Afghanistan at 2024. As we know better, that the immunization is a life-saving approach for the multiple communicable disease like pneumonia, COVID-19, polio, and etc. So, on the other hand, we can say the recent political changes caused that the refugee and returnees became a big issue for Afghanistan. So, with considering the importance of the topic, we decided to have our study about those returnees who are coming back from Pakistan to Afghanistan. In our study, we had one main objective that we were willing to find out the immunization coverage in these returnees. And the specific objectives for our study were as following, like we were willing to find the every antigens coverage level, and also to find the knowledge level of those caregivers who are parenting their children, and also to find out if there is any missing or refusal. We were willing to find out the causes of these, and also to find the recommendation for public health authorities. The methodology that we have used a descriptive cross-sectional study, and all those Afghans who are coming back from the 3rd October of 2023, we have included them in our study. And all those who came back from this date, we have excluded them from our study. The study setting was Nangarhar city, also with some of the districts who were those districts which were who had the increased amount of the refugees. The sample size for our study was 422, and the sampling method was used as simple random sampling. For the data collection and management, we used a pre-designed structured questionnaire, and we used and managed all our data in EPN4. The analysis has been done in 2 different categories, in the descriptive level and also in the categorical level. And for the ethical consideration, we gave a protocol to the ANPHI, and the IRB Institution Review Board gave us approval. As a result, we can say that we had about 56% of caregivers who were in 20 up to 30 years of age, also in appropriate age, and a less amount of them were over 40 years. Regarding the education level, unfortunately, the most of the caregivers were uneducated, and the less of them were educated. Regarding to the sex or gender, we can also say that the most of caregivers female, And regarding the geographical settlement, most of them were from Nangarhar, and they were settled there in Nangarhar, and least of them were from Kunduz province. The children who were involved in this study, the most of them were the male, and the age of most of them were at the second birth cohort, and the less amount of them were at the first birth cohort. We have already discussed these. I'm skipping this due to the lack of the time. The birth cohort of the children were most from the second birth cohort, and the targeted children, most of them are the male. Education level also discussed. The most important thing that we were to highlight was the immunization coverage. The immunization coverage that we have achieved or we have found in this study were most of them were for the OPV 0 and the least amount of them were for the measles 2, and the status of Penta 3 was only 53%. Some additional information were also collected. At the time of interview, we checked those children who are targeted in this study. Most of them has the BCG scar in their arm, and regarding of their caregivers, okay, sir. Regarding of their caregivers, most of them had the knowledge about the vaccine. It's an overall coverage of routine immunization that we can see it, and I have already discussed it. And also we can say that in this study, at the time of the study, there were no one to say it's haram regarding of the religious rule, regarding of the Islamic rules. Some other variables are also checked regarding of the health facility and also their relationship to their caregivers, and the immunization card that we have already seen at the time of the interview. These are also discussed. Last, we can say that the immunization coverage in overall for those who are targeted, who are survived, were satisfactory a little bit, but the thing that's most important that we have need to implement the measles campaign, to implement the polymonoplan for the prevention of the transmission of the viral. And also for the education level, we need some specific education regarding these disease. As a recommendation, we have already discussed that it's needed to increase their education level and also to increase the plans for the vaccination at the crossing points. Thank you so much.
Thank you so much.
In the name of Allah, from of the all, thank you for the panel. Give me the chance to describe our study about the knowledge, attitude, practice of COVID-19 vaccine among healthcare workers in 4 provinces of Afghanistan. Coronavirus or COVID-19 caused by SARS-CoV-2 virus. This virus was first reported in December 2029 in Wuhan, China. Coronavirus transmitted from person to person by droplets when an infected person sneezes and by direct contact. Evidence show healthcare workers are at the high risk of coronavirus since in direct contact with patients. To protect all healthcare workers and community, this should be prioritized, and they are necessary vaccinate all healthcare workers. Our objective in this study divided in 2 parts: main objective and specific objective. Main objective to determine knowledge, attitude, practice about COVID-19 vaccine in 4 provinces: Ghor, Balghis, Parwan, and Panjshir. A specific objective to determine vaccine coverage in healthcare workers in this province, determine refusal, barrier, and rumor toward COVID-19 vaccine in this province, and to provide recommendation for health policymakers based on finding of this study. Part of methodology, our study design a cross-sectional study conjugated in 4 provinces: Panjshir, Parwan, and Ghor, Balghis. Study duration conjugated between August 2023 until 2024, April 2024. Sampling method and sample size. In total, 425 healthcare workers selected randomly and interviewed using a structured questionnaire. Questionnaire we are on
socio-demographic factor, knowledge of COVID-19 vaccine, attitude, practice, and barrier of COVID-19 vaccination. Data was interpreted and analyzed in info version 7, and categorical data was analyzed using frequency, percentage, and other things. Our result from total interviewed healthcare worker, least of them were male, and more 16 healthcare worker were female in our study. In our study, more of 19 healthcare worker had a knowledge about COVID-19 virus, and also more of 19 healthcare worker knew about COVID-19 vaccine. The most common source of information was TV, and followed by social media. 18 healthcare worker agreed with safety vaccine COVID-19, and also nearly 81 healthcare worker reasons for not taking 81 nearly healthcare worker taking vaccine COVID-19. This part showed the graph of knowledge about COVID-19 vaccine among healthcare workers. More of healthcare worker interviewed had a knowledge about COVID-19 vaccine. This graph attitude about COVID-19 vaccine safety. Most of healthcare workers agreed with the COVID-19 vaccine is safe. Number of vaccination healthcare worker, most of healthcare worker vaccinated COVID-19 vaccine. Barrier of taking of COVID-19 vaccine, the majority of healthcare workers said for us fear of the side effect for not taking the COVID-19 vaccine, and followed by rumor unavailable of vaccine and other. Discussion. Our majority finding in our research.
30 seconds.
Okay. Most of 19 healthcare worker knowledge about COVID-19 vaccine, and the cross-sectional study conjugated in Oman showed the nearly 88% of participant knowledge about COVID-19 vaccine. And other study, most of the healthcare worker, 18 healthcare worker agreed COVID-19 vaccine is safe, and another research conjugated in US among healthcare worker showed the 69 participants agreed with safety of COVID-19 vaccine. Our study finding among healthcare worker, nearly 81 healthcare worker taking vaccine COVID-19, and Oman, another conjugated in Oman found it over half of represented taking COVID-19 vaccine. Conclusion and recommendation. This study showed a high level knowledge, positive attitude, and good practice COVID-19 vaccine among healthcare workers. Few healthcare workers not vaccinated because from rover barrier and refusal results for COVID-19 vaccine. Our recommendation for this study, the awareness program, which has proven to play an important role in communicating information about the safety and effectiveness of vaccine to health worker and community, should continue, and attend health workers should be vaccinated through campaign and routine immunization strategies. Thank you so much.
Thank you so much, Dr. We would like to request Dr. Al-Ain Abbasi to present her presentation regarding human papilloma virus infection and attitude towards HPV vaccination.
Assalamu alaikum everyone. I am Dr. Al-Ain Abbasi, and I am a pediatric resident at the Shafakhane University. And the topic of my study is knowledge about human papilloma virus infection and attitude towards HPV vaccination among healthcare workers. So, a little background about my study is that human papilloma virus is a ubiquitous virus found in our environment, which infects basal epithelial cells in the cutaneous and mucosal tissues. And it is basically a group of double-stranded DNA viruses the most common sexually transmitted infection worldwide. And it leads to 5% of global cancers annually. So it is basically divided into low-risk types, which do not usually have a malignant potential, and there are high-risk types, and there are 12 strains which are most commonly classified as these high-risk types. And the most frequently occurring ones are HPV type 16 and 18. And they usually cause anal, oropharyngeal, penile, vaginal, vulvar, and the most common is the cervical cancer. So, a little background regarding the HPV vaccination. The FDA approved the first HPV vaccine to prevent cervical cancer back in 2006. And in 2008, Dr. Zerhausen was awarded the Nobel Prize for identifying the role of HPV infection in cervical cancer. In 2012, HPV DNA tests with Pap tests were recommended worldwide for cervical cancer screening as well as its prevention. And finally, in 2013, the Gavi Alliance helped bring the HPV vaccine to poor countries for under $5 per dose. So the objectives of my study were to assess the knowledge about HPV infection among healthcare workers at the Al-Khan University Hospital, and also to assess attitude towards HPV vaccination among these healthcare workers. So the methodology of my study, this was basically a descriptive cross-sectional study, and I used the non-probability purposive sampling for a selection of my samples. My study was conducted among 3 departments: the Family Medicine, Pediatric, and Obstetric and Gynecology department of the Al-Khan University Hospital. And it also included the same departments from secondary care centers of Al-Khan University, which are placed in Garden and Karimabad in Karachi. So my study had a total duration period of 6 months, and it was approved by the ERC at AKU. So coming to the results. So generally what we found is that even being doctors, many people had some erroneous and misconceptions regarding HPV infections, especially related to its transmission. For example, around 3.5% of doctors did not know that it can be transmitted via kissing an HPV affected individual, although 93.5% of the doctors were aware regarding the sexual transmission method. There were also other methods defined by these doctors, such as a direct skin contact, contact with the lesion affected with HPV, promiscuity, and blood transfusions, open wounds as well. Out of a total of sample size of 200, only 60 out of 200 doctors were aware of all of the transmission methods in a correct manner.
You have 1 minute.
Considering the overall percentage, this is less value, and considering the fact that doctors are considered the epitome of knowledge in our society in general. So this was a little surprising to see that out of my entire data sample, only 30% correctly identified all HPV transmission infection methods correctly. So, moving on to the next slide. Now, what happened is that there were no doctors who correctly identified all conditions that can be caused by HPV. So, there were basically some misconceptions. For example, around 8% of the doctors said that HPV causes acquired immunodeficiency syndrome, which is basically caused by HIV and not HPV. Similarly, many of them were unaware regarding the potential of HPV in causing head and neck cancers, especially esophageal cancer as well as the throat cancer. So coming to the attitude towards the vaccinations for HPV, now this was generally recorded as a good response overall among all the three departments. And however, there were around 4.5% of the doctors who were unaware that there is any screening available for the human papillomavirus. Similarly, 12.5% of them did not know that it can be detected via a pap smear, and around 5% said that they would not encourage their close relatives to get vaccinated for HPV. An important aspect over here of note is that 24.5% of my participants did not know that it can be used among adults and children both. They only thought that the HPV vaccine is for use in adults alone. Similarly, around 68%, which is a significant value, 68% of my participants thought that it can be used in females only. So the actual fact is that the HPV vaccine can be used among males and females both, and it can be used among children greater than 9 years of age as well as in adults. So coming to this discussion, so similar studies were conducted in various countries, and in Thailand, Bangkok, only 17% of the respondent doctors correctly knew about the efficacy of HPV vaccine in preventing the HPV infection, which is in contrast to our study where around 93.5% of the participants thought that yes, it would be effective against the HPV infection. In Nepal, although 79% doctors acknowledged HPV-associated cancers in men and women, less than 50% knew about the cancers of the vulva, penis, and the anus. And only 20% knew that head and neck cancers can be a sequel of HPV infection. Similarly, in Jordan, 46% of the participants thought that the vaccine can be used in females alone, as did 32% of ours. In a study conducted among Brazilian physicians, less than 50% were right in their responses to questions about cancers caused by the human papillomavirus, and this was consistent with our study in which 35% were aware. So, in conclusion, my study highlights the knowledge gaps and misconceptions about human papillomavirus among healthcare workers, and especially related to its screening as well as its vaccination. And by aligning with global trends, my study can help provide guidance for optimizing awareness programs regarding HPV prevention and the general population, especially once the vaccine is introduced properly in my country. So my recommendations would include that during the introduction of the HPV vaccine in any national program in any country, local market availability should be ensured, and this is vital to this process because there were a lot of availability issues of HPV vaccine in Pakistan recently. And apart from that, to help increase the overall knowledge of healthcare workers on human papillomavirus, so it is a good idea to have frequent continuing medical education sessions, which timely answer any queries pertaining to HPV in a cost-effective and time-saving manner. So thank you very much. If we have any questions, I'm happy to answer.
Dr. Said Muhammad Ilyas Hoshman. Dr. Said Nur Hassan Saidi.
Nur Hassan Saidi sir.
Dr. Said Nur Ahmad Muri.
Dara Shah Ahmad. So doctor said Muhammad Qasim Naik. So doctor said Jamaluddin Mudafi.
خلاص
حتى نشتغل يبقى نشتغل
تصرف
Last, may I request Dr. Ashman Pardes to present the momentum to our corner chair and co-chair.
Thank you.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon to everybody. Today I have a brief presentation on implementation research on societal behavior. The topic was evaluate the adoption of societal behavior detection and prevention practiced by psychosocial counselor working on the BPHS primary healthcare level in Afghanistan. As you are aware that societal behavior is a public health issue, global public health issue that nearly it is 800,000 deaths occurred by suicide in 2016, and which equal to one suicide every 40 seconds. In every 40 seconds, one life is dead by suicide by themselves in attempt. And the main result of suicidal behavior is that mental disorder, especially depression, is common, and psychological, social, and cultural factor is involved in that. And about 79% of suicide occur in low and middle countries like in Afghanistan, Pakistan, Iran. These are low and middle income countries. And unfortunately, it is unreported, the most of suicidal behaviors, due to the stigma, shame, and religious factors that involve that. And also the low and middle income countries, there is no specific registration system to register these people and they don't have a development register system in the low and middle income countries. In Afghanistan, we say that some reports say that the majority suicide case among the women and young girls. And the first 6 months of 2014, approximately one report say that 4,136 people are burned in themselves. And the HMI's data show that it is 4,466 cases are drug poisoning, and also 1,146 cases are burned, and 1,445 cases of poisoning. So it showed that it is so common, but it is unfortunately it is not reported. And National Mental Health Survey that conducted in 2018, it showed that the lifetime prevalence rate in Afghanistan, it is 7.25%. And also suicidal plan in attempt is 3.96% and 3.43% respectively. In the other research that conducted and recently in 2021 and 2022, especially when the government changed, it showed that this study was conducted between the university students showed that it is increased the cases. It showed that 38.6% suicide ideations are among the 214 students. And the other study that showed that it is responded for the females. It showed that 87% of depression symptoms, the suffering, and also 49.8% the suffering from suicidal thoughts. It is more. It is very huge. So unfortunately, but we have these cases, but unfortunately we don't have services for these peoples. Only we have a data in Afghanistan. If we say that at community-based level, we don't have a prevention and detection program for that. Only we have a primary healthcare level. In Afghanistan, we have a support for these peoples for common mental disorders, including suicidal thoughts. The objective of this presentation or this study was that we only have that mentioned that in primary healthcare level, we have a psychosocial counselors, they're working, and that provide MHPSS services, including the CHCs. So the objective of this study was to ascertain the adoption of suicidal behavior detection and prevention practiced by psychosocial counselors. They're working at the primary healthcare level in the CHC. In the same times, to assess the gap, what was the gap in challenges provision of preventive counseling service carried out by psychosocial counselors. During these studies, this was the qualitative study. The participants were from 22 provinces. It is 78 psychosocial counselors and 90 medical doctors, nurses, and midwives participated in this study. And it is a semi-structured interview topic guide was used in 41 individual interview. In this 41, 22 psychosocial counselors and 19 medical doctors are interviewed individually. And 56 psychosocial counselors is participated in focus group discussion. And the data was the audio format were transcribed and analyzed in original language and use Atlas TI9 software for data analysis. The result in analysis showed that we use the innovation of determinants of Florence is used in that. And totally the main theme, 4 themes were developed in this study. The first main theme was determinant related to health professional. And the second theme was determinant related to innovation about contextualization of the societal behavior and training materials. And the third one is determinant related to organization. And the fourth one is determinant related to cultural. So the determinant related to health professional, we observed or evaluated the technical capacity for suicidal behavior of the psychosocial counselors. Generally, the most responded were familiar with the intervention in use for suicidal behavior mentioned in their guidelines, and they were confident in their own abilities. And the consultation length, most of respondents said that the first consultation session took 60 minutes and 90 minutes, and the follow-up sessions took 20 to 35 minutes. I think I don't know why it is the other column is not coming. So this is problem. Poyado you Emma. Huh? Okay. So the second theme was determinant related to innovation. So the intervention tools in contextualization was done in, it was contextualized. The materials that we observed that it is contextualized, and also clarity of the intervention tools for psychosocial counselors clear, and they know about that. They have these intervention and acceptability of the intervention and tools to clients' cooperation. According to the health social counselors, the client was cooperated with them, and also the material, the intervention that used for suicidal behavior was acceptable for them. And the other thing was determinant related to organization, the space and equipment, tools availability at health facility. This is very important that 33 out of 78 psychosocial counselors not had suitable rooms for counselings, and they could not ensure client privacy and confidentiality. As you know that confidentiality and privacy is very important for the clients to during the sessions. And also linkage between the health facility staff within the comprehensive health centers, that medical doctor, midwives, nurse, and psychosocial counselors, it was observed that the referral system is depend on the, according to the psychosocial counselors, that the doctor receive the mental health training, then the referral system is strength. Otherwise, there is no referral system between medical doctors and psychosocial counselors. In the post-training follow-up sessions, it is very important after the training to the first follow-up session in technical supervision. It is 2 weeks. And okay, it is final. So the cultural structure, based on the cultural restriction, the female counselor is not allowed to arrange counseling session with the male clients, and likewise, the female psychosocial counselors cannot arrange counseling session with the female. This is very important, but if we only have one psychosocial counselor in the health systems, male or female, because according to the BPHS. So there is, according to this, there is needed for 2 psychosocial counselors to provide services for male and female clients. And common risk factor for these was the risk factor for the suicidal ideation or thoughts. That was the culturally, the main stressor was poverty, family problems, and forced marriage. The conclusion was that to the guideline intervention tools for suicidal behaviors used was psychosocial were contextualized, and it is compatible according to the context they were working in. And psychosocial counselors were familiar about suicidal thoughts, detection, intervention that mentioned in the guidelines. On the other hand, the barrier that affect the suicidal behavior in counseling service at the primary care level need to be improved. Only I have recommendation for that, so because it is very important we have only one psychosocial counselor. The first, my recommendation, according to this study, availability in male and female psychosocial counselor at the comprehensive health center, at least to provide services for the affected people populations. And enhance equip rooms for counseling session to ensure privacy and confidentiality for the clients. And enhance the regular supply for recording the patient information, register books, patient files, and assessment for suicidal behavior, and create sustainable supervision program to increase their knowledge and skills at the interventions, and enhance the capacity of health staff, medical doctors, nurses, midwives, to strengthen the referral system between the psychosocial counselors and medical doctor to provide biopsychosocial model. Thank you for your attention, and thank you. Thank you. So,
good afternoon, ladies and gentlemen. I think we are close to end our today conference. So I want to briefly present my presentation. My presentation topic is the image pieces, learning needs and service gap in community-based education program in the 4 provinces of Afghanistan. Next, please. Introduction. Community-based framework in Afghanistan is designed to provide education opportunity for those children who are located to various barriers such as distance, insecurity, and culture constraint or culture limitation. So they cannot access to the formal education. So this is why the community-based education is established by the government of Afghanistan. All these factors or barriers like insecurity, culture barriers, and distance, it is impacting the community-based education students, impacting the psychosocial well-being of the children who are studying in the community-based education programs. All these barrier or risk factors happen while about half of the children begin mental illness in the childhood period. Next. Please, next. Yes. Objective of this study. We have 2 main objectives in this study. One is to identify the image pieces learning needs among CB program, community-based education program, teacher, officer, master trainers, and others who are working in the community-based education program. The second objective of this study is to identify the image pieces service gap among community-based education program. These are the 2 main objectives of this study. Methodology, it is basically qualitative study with mixed method. In this study, we conducted 3 focus groups with teacher, community-based education program, teacher, officer, and also master trainer. And also we conducted the 31 KI or key informing interview with teacher, trainer, and officer or supervisor. Meanwhile, we had a desk review of the teacher guides and also the WHO School Mental Health Training Manual and also UNESCO teacher guides for the social emotional learning purpose. We reviewed these 3 training manuals during our studies. Result, we show the result in the 3 areas. One of them is the stressor. We found during our research or study, there was significant stressor impacting the psychosocial well-being of the community-based education program students. The main stressor was the poverty, displacement, child labor, discrimination, a lack of the family support are the major stressors for the community-based education programs. Regarding the image pieces learning gaps, there was a critical lack of mental health and psychosocial support, capacity in awareness identified among community-based education programs workers. So this is the main things we found about the lack of the mental health psychosocial support capacity. The staff was not capable to find the case among the children. And also the second, through the desk review, we found the guideline, the teacher guideline was not ineffective to address the psychosocial problem among the children and provide the support, psychosocial support to the students. And also we found the WHO School Mental Health Training Manual, which is released since 1 year. It was the best option for the school mental health program in the formal and informal education program. The WHO school, the community-based education supervisor who supervised these community-based education program, supervisor, master trainer, and officer who are the responsible for the support to the community-based education program. It was technically, from the technical perspective, it was not capable to support the community-based education program. And also, through MHPC surveys, the third area which found regarding the MHPC surveys, the school lack of formal screening methods for the learning difficulty or mental health and psychosocial problems, and also absence of the MHPC's mental health psychosocial support in the CB program, coupled with weak referral system in the community-based education. School lack data collection and reporting tools for the school mental health program activity. Okay. Discussion, there was sufficient stressor. The MHPC's school mental health program was not exist. The screening was not available in place in the community-based education, and also no one participated in the school-related training programs. The majority of the responding reported having minimal or knowledge or no knowledge of the school-related mental health issues. Conclusion, I don't want to say about the conclusion, just I want to say about the recommendation. Here we have a 5 recommendation. The WHO School Mental Health Program training resource was the best option to contextualize to meet the needs of the community-based education program. The second is the conducting school mental health training is a crucial for the capacity building of master trainer, supervisor, officer to cascade the training for the community-based education program teachers. The third recommendation is the developing the referral pathway for accessing the MHPC's community-based education program is essential to reach the client's needs in community-based education. The fourth one is the community dialogue with parents to be facilitated by school teachers and supervisors should be organized at the district level by the district CBE focal points in this program. The last recommendation is it is recommended to organize recreational activity such as cricket, football tournament for all district level to facilitate the awareness rising and also psychosocial, to ensure the psychosocial well-being in the community-based education program. Thank you. No health without mental health.
Thank you, Dr. And it's a turn of our third presenter, and also I'm going to request from all the presenters we have short and we are probably requested them to present their abstract in 6 minutes. Thank you.
Thank you.
So, first of all, Assalamu alaikum and a very warm afternoon to everyone. As you know, my name is Ibrahim Shah and I am a Master's in Nursing Scholar from Al School of Nursing. And it's my immense pleasure for me to present at the 14th FMIC Annual International Scientific Conference and Quality Convention. Basically, today I'm presenting my master's thesis project, which titled is Assessing Primary Healthcare Professional Awareness and Understanding of the Relationship between the Climate Change and Mental Health. It is a cross-sectional analytical study. So can you please move the slide? Okay, so as we know, climate is not just an environmental issue, but a growing public health problem. And research on that particular topic shows that these events have devastating mental health consequences, not directly but indirectly, which leads to post-traumatic disease, anxiety, depression, which sometimes ends up with the domestic violence as well. And WHO also shared that climate change is expected to result in approximately 25,000 additional deaths annually by 2030 to 50. And when we talk about Pakistan, of the vulnerable country due to the climatic events, and recent disaster happened in the form of floods and heat waves. These are becoming increasingly common in our context, and millions of lives are affected due to this. So, however, there's a significant gap exists in the preparedness and the awareness regarding the psychological impacts regarding to this climatic events. So, most healthcare providers have the awareness, but they don't have any kind of readiness. Next slide. So my study objective and aim was to determine the level of awareness among the primary healthcare professionals regarding the connection or link between the climate change and the mental health. And basically, this study took place in the Aga Khan Health Service Pakistan centers throughout the Pakistan, both in southern and the northern part of the country. And we adopted a quantitative analytical study, and the tool which I used for my study was a Minnesota survey tool, climate change mental health tool, which we adopted according to our context. And the study location, as you see, the Gilgit-Baltistan, and Sindh, are comprised of rural and urban areas. Next slide. So the data collection, actually, the participants and the process which I followed was I did with the universal sampling to approach all the healthcare professionals working in the HSP center, and the study we went to 66 primary healthcare centers across the country, and that includes 70 districts. And the data were collected from July to September 24, and we had a total of 263 participants who met the eligibility criteria, and 46, out of which 46 were males and 270 were females. And the participants, the questionnaire, the tool which we used were around 37 items and 10 sections, and the survey utilized a Likert scale questions ranging from strongly agree to disagree. And the majority, as you see, the data, the participants were the lady health visitors, which accounted for 49% of the sample, and the registered nurses made up 15.2%, and the rest included general physician, pharmacists, the midwives, and all. So this is all data. So next slide. So this map shows the geographical distribution of all my participants. So Gilgit, from Gilgit.
Dear Mr. Shaw, please focus on the result. Please focus.
Sorry?
Please go to the result section. Don't focus on methodology. We have less time.
Okay, now next slide. Next slide. Okay, these are the statistical analysis which I used for my the result. I talk about the result section. So I use both descriptive analysis and inferential analysis. Can you press next slide? So these are the sections which I covered. So through processing my data analysis, firstly, these are all 8-9 sections in which I assess different variables, and also by using ANOVA test and chi-square test, I relate all the variables as well. Can you please press the next slide? So the demographic data which represent, as I said, the 82.5% were the female participants in the study, and the average age was 37 years, and the average year of experiences of the participants were 12.5 years. And the education level were most of the individual intermediate staff who are working as a LHV or at the midwifery level, and 30.79% were bachelor's degree individuals, and the 49%, as I said, the lady health visitors, and 97% of the health facility were the private healthcare facility, and 2.6 was towards the public partners, and 17.7% of the data were collected from the suburban area, and remaining 18.6 from rural and 10% from urban. Next slide. And this is basically the demographic analysis of the awareness which I observed. Mostly the 99% of the participants agreed to the statement that climate is a very important issue to them, and they're reflecting strongly about its significance. And 98% were agreed that climate change impacting the mental. They have a good knowledge about the awareness about this phenomenon. Next slide. When we talk about the different terminologies, so mostly 24.3% were familiar with the term climate anxiety, and similarly 40.7% are familiar. Eco-anxiety mostly were 17.1% were familiar with this term, and similarly when I talk about the solastalgia, so was least recognized by the participants. So this data shows
1 minute left.
I can't hear you, please can you repeat your question?
1 minute left. You have just 1 minute.
Okay, next slide. Okay, similarly this is also shows the perception around 62% they feel prepared to discuss climatic topic with their participants. Next slide. And when we talk about the observation of the evidence, so 37% of participants reported with depression among their clients. Similar 32% shows the anxiety in their clients. They show to them, and domestic violence and grief. They are the variables which we identified in particular areas. Next slide. So the chi-square which I ran to examine the association between the familiarity and the participant region of resilience, that shows that most of the urban participants have the highest familiarity as compared to the rural area, and the climate index, like urban participants are more likely to be familiar with which are 82% were familiar, and in contrast the rural participant have a 44% familiarity. So it shows a significant result, and also eco-anxiety. If those have a good understanding about the familiarity about the term, they have a good knowledge about the climatic event. Next slide. So the ANOVA test also share that the difference among the participant, those climatic event level of familiarity among them, that shows the significant result. Participants were familiar with the term eco-grief, climate grief, and solastalgia. So there is the significance observed. Those who have climate anxiety or eco-anxiety, the term awareness, they have a good understanding about climate events. So what are the gaps? Next slide. So the limitation in strength, when we talk about this study is one of its kind that fill the gaps in the research by exploring the perceptions of the primary healthcare professionals in Pakistan, and it used a very diverse level of participants from across the country, and the tool which we used, we validated it. The limitation which observed it particularly focused on the primary healthcare professionals working to the AKHs actually. I didn't went to observe the public sector actually, and also this is a cross-sectional study. It needs a longitudinal study. So next slide.
I'm over there, Mr.
Okay, so this is my recommendations, and last slide. The next slide, please. Okay, so the conclusion for my study is just to have more awareness regarding climatic topics, and specifically connection with the mental health, and it needs more training, more hands-on, and more information regarding this topic. So this is from my side again. Thank you so much for everyone for having me.
Thank you.
Any questions?
Thank you. We are going to take the question at the end.
Bismillah ar-Rahman ar-Rahim. First of all, Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon. Hope everybody feeling well. By the permission of all respected guests and participants, I want to share the semi-structured qualitative study, which is mental health and psychosocial support among psychosocial counselor and community health worker in Afghanistan. First, next slide. First, I want to define what is MHPSS stand for and what is the definition of MHPSS. Mental health and psychosocial support, MHPSS refers to any local or outside support that aims to protect or promote psychosocial well-being or prevent or treat psychosocial conditions. And what is mental health? Mental health is a state of well-being which every individual realizes his or her abilities, can cope with the normal stress of their lives, can work productively, and is able to make a contribution in his or her community. And what is psychosocial support means? Psychosocial support refers to action that address the social or psychological needs of individual, families, and communities. And what is the significant mental health burden in globally? In globally, 450 million people live with mental disorder, and 1 out of 4 persons affected by a mental disorder at the same stage of their lives, and 50% of people with mental disorder in high-income countries, and 85% of persons in low and middle-income countries have no access to the mental health services. And every 42nd, one person suicide because of mental health problems. And more than 50% of the population in LMIC suffer from mental disorder at the same stage of their lives. The objective of this study is, the first objective of this study is MHPSS learning need assessment to identify the gaps in MHPSS knowledge and skills of psychosocial counselor and community health workers in Afghanistan. And the second objective of this research is that capacity strengthening of psychosocial counselor and community health workers and the gaps points based on learning need assessment. The methodology, a mixed method approach was used. It means qualitative and quantitative method is used in the study, and key informant interview with psychosocial conducted with psychosocial counselors, CHW, medical doctors, midwives, nurse, and psychosocial counselor. And also focus group discussions was conducted with CHW and teachers. And our sampling method was a convenient sampling method from 4 provinces, including Kabul. And the individual interviews questionnaire covered the topic of MHPSS knowledge, skills, challenges, and training needs. And focus group discussions questionnaire conducted the topic of explored perception, attitudes, and practice related to the MHPSS. And also a desk review of existing MHPSS training materials was also conducted to assess the quality of the services. And data was analyzed using thematic method to identify key themes and gaps. Like previously, I said this is the methodology. We conduct focus group discussions. We also conducted individual interviews and desk review. This is the table of persons or we conducted interviews with us. We did individual interview. We conducted individual interview with 5 psychosocial counselors and also 8 CHW. Total 44 individual interview conducted with the relevant participants. And also we conducted 6 focus group discussions with different people, CHW and teachers. And at this review, we review all information related to the MHPSS of UNICEF implementing partner organization and also resources center that serve the children and UNICEF, WHO or MOPH existing materials related to the MHPSS. The result of this study, the assessment found various gaps in MHPSS knowledge and skills among different areas of health workers. The first result is that the CHW had a limited awareness of mental health and their roles in identification, referral, and psychosocial support. medical doctors and nurses and midwives had inadequate training in integrating image pieces into the routine cares, and psychosocial counselors lacked an in-depth understanding of mental health condition and psychosocial intervention and faced challenges in providing comprehensive image pieces services. And gaps were also identified in the quality and coverage of image pieces training materials with a need for more comprehensive competency-based programs. And also we found that the counselor have insufficient practical knowledge of image pieces while working with children. This is the biggest gaps we found in our study. And also we found that the psychosocial counselor have insufficient information how to effectively communicate with children, how to conduct group counseling, and how to run a group counseling, and how to end a group counseling. And also the principle of counseling, how to use practically the principle of psychosocial counseling. And also we found that the psychosocial counselor had the insufficient information about common mental health problems, and also we found that psychosocial counselor don't know about the child resilience and how can they build the child resilience. And also we found that they had have insufficient information about crisis event intervention, suicide and self-harm, and well-defined referral mechanism. This was the result of that study. In the conclusions, strengthening health workers' capacity in image pieces are vital for improving service access and quality in Afghanistan. Comprehensive competency-based training programs are necessary. Supervision and support system are essential for various health workers' cadres, and targeted funding by the donors to implement image pieces integration in the healthcare system. This was the conclusion. And the recommendations related to the psychosocial counselor and health social counselor provide regular refresher training focusing on child mental health is so essential. Ensure a nutrition counselor receive basic psychosocial counseling training. Revise the TOR of psychosocial counselor and advocate for both male and female counselor in Afghanistan. And for community health workers CHW, revise the TOR of CHW to include image pieces task and implement initial and ongoing training for CHW. And the supervision, supportive supervision parts, develop and implement an image pieces supervision guidelines, training staff, and the new guidelines and support supervision practice, enhance supervisor capacity for technical support. This was related to the, I skipped this. Thank you for your attention.
Thank you. Thank you, Mr.
Thank you for
welcome to the last presentation.
Human blood is vital, life-saving component. And the WHO has recommended that at least 1% of the population should donate blood every year to meet the demands of the population. In Afghanistan, as I said, we face the shortage of blood every day. And Afghanistan has an ongoing and urgent need for blood. Yet, the blood donation, the blood is, and we face the shortage of blood every day. Why did I choose the medical students for this study? It is because the medical students are soon to be the backbone of our healthcare system, and their perspective about this specific topic is important for us. The aim of my study is to assess whether the medical students know about blood donation, how is their attitude towards it, and do they really practice it or not. I have conducted a cross-sectional descriptive study with a couple medical students. In my study, 357 students randomly were selected with equal number of male and female who answered to our pre-tested questionnaire, which was contained 25 questions. The data collection and the survey was conducted during September to December 2022. Results coming to the knowledge, we assessed the results of the participants using 12 questions. And fortunately, the results were good. 46.4% of the students showed good knowledge, and 50.7% of the students had showed average or moderate knowledge, and just 2.9% of the students showed bad knowledge, which is overall good, but there is room for improvement. Coming to the attitude, I'm very excited, and it is very interesting finding that most of our participants showed positive knowledge toward the blood donation, which is 82.7% of the students. Coming to the practice, the picture changes completely. Only 16% of the students donated blood, with a high number of male rather than the female. Male students had donated blood more than the female students. There were some barriers who we asked the non-donors what are the barriers that they did not donate blood. And the most answered was lack of request. They said nobody has asked me to donate blood. If they had asked me, I would have donated. Another barrier was misconceptions. The misconceptions were among girls mostly. They were thinking that if they would donate blood, they'll get anemia or they'll get sick or weak. Motivation, 98% of the donors said their motivation was altruism, helping to others. Our key findings in this study was that the knowledge level between male and female was higher in female. But the donation rate or the practice rate was higher in male students, which means that there is no significant relationship between the knowledge or the attitude and practice. I have compared my study with some of the studies from different countries that had the same context and culture as our country, like Pakistan.
1 minute left.
Okay. In Pakistan, in a study, 15% of the participants had donated blood, mostly men, and the main barrier was lack of request, same as our study. In Iran, 10%, in Saudi Arabia, 14%, and in India, 18% had donated blood, and they all showed good knowledge and positive attitude towards it. In conclusion, in our study, we found out that the knowledge of the participants were moderate, the attitude of them were positive, and still, the practice remained low, which it needs some encouragement for the students to donate blood. And as we compare our study to other studies, we see that the same pattern is going on in different countries. The barriers, as I said, the main barrier was lack of request. We can request the students to donate blood, we can encourage them. My recommendations are implementing educational workshops for students and for population, setting up a mobile team for blood donation at universities and at public places, and addressing misconceptions to foster a culture of blood donation. These are the references. And before I finish, I want you all to, I hope that my presentation has dragged your attention to this important matter, which is blood donation. And let's work together to make blood donation more acceptable, accessible, and understood, and practiced. Thank you.
ما فقط روی دو نکته میخوایم اشاره بکنیم. نخست از همه شخصا از جانب خود و وکالتا از جانب جامعه جراحان افغانستان که نو تولد شده که کنیم ما قبل و مخصوصا کمیته اساسگذار جامعه جراح که FMIC ما را به کنفرانس دعوت کردن، اظهار سپاس و امتنان دارم. فکر میکنم مهم نیست که ما چقدر زندگی میکنیم، اما این بسیار مهم است که ما چگونه زندگی میکنیم و این زندگی هم جاده یک طرفه است که عقب گردش ممکن نیست. آنچه کردی میمانه و آنچه نکردی سپری میشه. ما زیاد خوش هستم که برای اولین بار در چنین کنفرانس دعوت شدیم و اشتراک کردیم. چند نکته را که در رابطه با کنفرانس میخوایم مختصرا عرض بکنم. یکی از کنفرانس های عالی را امروز شاهد بودم که از بسا نقاط نظر میتونیم سرش تاکید بکنیم. پرزنتیشن های عالی، کار عالی، در نظر گرفتن وقت کافی، وقت درست، آماده ساختن پرزنتیشن ها تقریبا در به حالت بین المللی. خلاصه اگر کنفرانس نگویم که یک کنفرانس جهانی بود، کمتر از یک کنفرانس جهانی هم نبود، اما مطمئناً که از کنفرانس های بهتر منطقه بوده. ما امیدوار هستم که ما بتانیم با این گام روابط نزدیک را میان جامعه جراحان افغانستان و FMIC ایجاد بکنیم تا بتانیم کارهای بیشتر تحقیقاتی و علمی و اکادمیک در سالهای بعدی سازماندهی بکنیم. شاید علاقمند باشین که اعلان را که متخصص حارس مطرح کردن که یکی از عالی ترین مدال های جامعه جراحان آلمان، بله، از یک کشوری که تقریبا 50 سال ازش صدای جنگ، کشتن، بستن، زندانی ساختن، اعدام کردن، بمباردمان، خشونت در جهان بلند بود، به یک بارگی در یکی از عالی ترین کنگره های جهانی، 141مین کنگره جهانی جامعه جراحان آلمان که 152 سال سابقه کار در جهان داره و جراحی جهان سوق میده. جراحی جهان زیر کنترل جامعه جراحان آلمان است. در میان تقریبا 1500 پروفسور جراحی جهانی که در اونجا اشتراک داشتن، اعلان میشه که برنده عالی ترین جایزه جهانی لیوناردو شوایبر سال 2024 یکی از دکترای افغانستان است. رفتیم سر استیج، گرفتیم جایزه را. در همونجا من یادآوری کردم که این جایزه بر من نیست، این بر مردم افغانستان، جامعه طبی افغانستان و مخصوصا خانواده جراحی افغانستان است که در این مدت زمان واقعا سخت تلاش کردن و کارهای بزرگ را انجام دادن. بر من کنگره 141مین انگیزه داد که ما چرا نداریم چنین چیز را، چرا ما در افغانستان جامعه جراحی نداریم. آمدیم با تعداد از دوستا، هم مسلکا، هم کارا صحبت‌های را کردیم. 5 ماه تقریبا تلاش خستگی ناپذیر با متخصص ابراهیمی، متخصص حارس، با پوهان صاحب سامیه جان، پوهان صاحب پیرزاد، نوری صاحب و سایر دوستا انجام دادیم. کنفرانس های علمی را سازمان دادیم تا بالاخره تانستیم که جامعه جراحان افغانستان به تاریخ 3 نوامبر به دنیا بیاریمش و کار خود را آغاز بکنم. و در این جامعه جراحا کارهای بزرگ را در پیشروی خواهیم داشت. این انگیزه سبب شد که ما بتانیم کارهای را به خاطر آینده جراحی کشور خود سازماندهی بکنیم. ما زیاد علاقمند بودم که مدال لیوناردو شوایبر بر وزارت محترم صحتمند و یا پانتون طبی کابل اهدا بکنم. خب بر جامعه طبی افغانستان اهدا شد. میخواستم که تسلیم بکنم، اهدا شده بود، اما بنابر دشواری های کوچک نشد و من تصمیم گرفتم که مدال لیوناردو شوایبر در روی تندیس آماده بسازم و این تندیس از جانب خود که توفیه از بر او مراجع اکادمیک و خدماتی صحی ما که کارهای بزرگ را انجام دادن از جانب خود بر از اینا توفیه بتم و تا این افتخار در این شفاخانه ها و این نهادهای اکادمیک جا داشته باشه. که از اون جمله یکی هم FMIC است که با سازماندهی چنین کنفرانس که امروز من متوجه شدم، فکر میکنم که یکی از مستحقین است که باید این تندیس با خود داشته باشه. در این تندیس در قسمت بالا شما نشان خود جامعه جراحان آلمان هم میبینین در پالوش دی جی سی اچ دوچه گزلشافت فرشیرورگی یا جامعه جراحان آلمان و این هم مدال لیوناردو شوایبر جامعه جراحان آلمان و این پشت سر مدال و درش نوشته است که مدال لیوناردو شوایبر جامعه جراحان آلمان از طرف دریافت کننده پروفسور دکتر بسم الله شیوامل برای جامعه طبیبان افغانستان اهدا شد که چون FMIC جزء از جامعه طبیبای افغانستان است، ایرا امیدوار هستم که رهبری FMIC بپذیرند و ما را افتخار ببخشند. فقط ما به این عقیده هستم که از یک جای باید آغاز کرد. خوشبخت هستم که شفاخانه FMIC از مدت‌ها از 14 سال به این طرف این کار آغاز کرده و نهادهای دیگه اکادمیک و علمی و عرضه خدمات سیما هم این کار آغاز بکنن. یگانه راه نجات جامعه طبی ما از این حالت موجود همین کارهای علمی و تحقیقاتی و اکادمیک خواهد بود. ممنون هستم از همه شما. میفهم که وقت کوتاه است، اگر نه حرفای بسیار زیاده با شما داشتم. ممنون شما. تشکر.
Dr. Rolla Harris.
بسم الله الرحمن الرحيم ربي اشرح لي صدري ويسر لي أمري وحل عقدة من لساني يفقهوا قولي. Dear fellow researcher, respected colleagues, faculties, FMIC management, team around here and researcher, guests, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. Here we are at the concluding ceremony of 14th FMIC Annual International Conference and 14th Quality Convention. I hope that today you had productive and enjoyable days and very productive sessions which we have arranged for you all. This was the hard-working effort by scientific and organizing committee of FMIC management. We have started this work from June 2024, and here we are celebrating the International Scientific Conference at FMIC. I need to thank the management for supporting and sponsoring us for this valuable international conference. I also want to thank the partner for giving us the valuable support and financial support to hold this conference without any charge to the participant. I would also thank our IT team to make connection around the world, across the globe, with FMIC here in international conference. We had participants from international who present their awards, and also it was broadcasted internally to Afghanistan and also internationally. Nevertheless, I should also thank the food service and other logistic team who supported us during this ceremony. One of the biggest A nice presenter of this international conference at the beginning is Dr. Sarfaraz Karim, who also did the presentation at the beginning of this international conference. I appreciate the effort which were made by you and your team during this conference and during the study. We will give you the memento, I'm sure, in your unit. So I'm not going to speak much more because when I was crossing, I was hearing that please, in Farsi they were saying, Kota Gabzan wa Khalasha. So I will do that, and again, thank you. If I missed any member of FMIC, another team who sponsored and helped us during this, I'm really sorry for that, and please consider this as appreciation for you as well. So we will conclude this, and inshallah we will meet next year with 15th FMIC Annual International Conference and 15 quality conventions. ومن الله التوفيق ربنا ظلمنا أنفسنا وإن لم تغفر لنا وترحمنا لنكونن من الخاسرين برحمتك يا أرحم الراحمين. Thank you. Have a nice day and wish you all the best.